Hello guys, welcome. My name is Dr. Bryan Voithofer, and in this video I want to explain to you what could be causing your neck pain. Because I know that when you have neck pain, it's not fun, it's very uncomfortable, and you want to get rid of it. So whether it's an acute issue, maybe you're in a car accident, you had a whiplash injury in the past, or maybe you slept wrong, or maybe you had a sports injury, not sure. Or you might be dealing with something, maybe it's been chronic for the last 3 months to 6 months. You might sit at a desk for 5 to 6 hours a day for the last 10 years, which has caused a lot of these issues that you're suffering with right now. So my goal is to teach you a little bit about the spine, teach you what I'm going to look for that could be causing this issue or this neck pain. And if it's there, then remove it and get your body back to normal function and healing. So what we're going to be looking for is what I call subluxation in the back. That's a movement deficiency syndrome. All that means is these vertebrae need to be in alignment and they all need to be moving through a healthy full range of motion. If they're not, you're going to have problems. You're going to have increased pain, tension, and stiffness or pinched nerves. So let me tell you what normal is. So normal spine, first you need to know that there's 24 movable vertebrae, the bones in your back, the spinal column, from top to bottom. Now, from the front, the spine should be straight, again, from the top to the bottom. If we turn to the side, like I am right here, and this is my back, you should have 3 healthy curves in your back. One here, one in the mid-back, and one in your lower back. Now, when you have that spine straight from the front, and from the side, nice curves, these channels here you could see with these nerves, they're wide open. So there's no stress or tension, number one, on these nerves or these nerve roots going out. Now these nerves are carrying vital messages of function and healing to your entire body. If you look at this chart behind me, your brain sits here, sends a message down the spine and out these nerves to every single cell, tissue, and organ in your entire body. So it's a pretty amazing system, and they're going back and forth at a very high speed, a very high rate. So this spinal column, these bones, are surrounding and protecting the spinal cord inside here and these nerves, number one. Number two, it's good for healthy, remember I said movement, you need to be able to move. So this spine is mobile, and it does twist and it turns so that we can pick things up and play sports and sit down and stand up, right? Now, what could happen is if you ever felt anything like, man, I feel like I'm twisted, or I feel like I'm out of alignment, or you have neck pain or stiffness or numbness and tingling in your arm, what could happen is what I call subluxation, where these vertebrae shift out of alignment like this. So they twist and they get stuck. That's subluxation, and so is this, is when your neck, and I'm seeing this more and more, is when your neck starts to fall forward like this. Why would your neck do that? And why would it stay straight? That's subluxation. That's not good. That causes a lot of neck pain, stiffness, nerve pinching, degeneration of the disc in the front, osteoarthritis of these joints in the front. The reason is we are sitting and we're living in a day and time where we're doing a lot of texting, we're doing a lot of reading, let's hope, right? But we're keeping our head down a lot like this. People sleep on pillows that are way too high, pushing their head up. Some people have had accidents such as whiplash injury or car accidents, which again, vital to get some chiropractic care if you're getting a whiplash injury. What happens is we need to make sure, number one, that this neck is in a healthy alignment. And from the back, you need these vertebrae shifting and properly moving through the full range of motion. I'll look for these areas of deficiency, subluxation, remove the interference, and reduce the inflammatory cascade that's going on with your soft tissue around the joints here. And this is why a lot of people have neck pain and back pain. So as we start to restore alignment, restore movement back into these joints, take pressure off the nerves, the body starts to function better, it starts to heal, and you start to feel better. So that's what I'll look for. Hope to see you in the office. Take care of your temple. God bless. Dr. Bryan.